And this is really important, is hold the syringe like the right way. So the right way to hold it is like this. The reason is because if you hold it like this, technically you can hold it any way that's comfortable, but if you hold it like this, you're starting off right off the bat, you're gonna be too superficial. You see how that is? If you hold it like this, you're too superficial. If you hold it like this, you're gonna be way too deep. But if you hold it like this, almost without even doing anything, you go in, you're at the right depth. Let me can I turn your face all of this one? If you go in just like this, look at that. That's the correct depth. You don't even have to do anything special. You're right there. And now you have your hand here, okay? And then this thumb, you're gonna pull taut on the skin and you're gonna rest your hand right there. You're all set up. You could do it so easily. So there we go. Try to do it like that. Yeah, that's good. Good pressure. A lot of people are not familiar with the pressure of the syringe, and you have to press kind of hard to get the product out. And you didn't do this, but you never want to inject a bolus like in one area. You want to make sure you're moving. And there's many reasons for that. One is, of course, cosmetic, aesthetically, but for safety reasons, you know, if you're putting a whole bolus in one area, potentially you could compress a blood vessel, right? So, and you don't need to do that. So you're injecting as you're moving. Yeah. And the depth is also very important because, you know, your blood vessels, your more important structures are deeper. So you want to be into the dermis, which is where you're at. So you're doing fine. And kind of put it down, the needle. Yeah, that's it. Good, okay. All right, now stop. You see how it came out? Technically, they say you could get a track, so you don't want to continue injecting as it's coming out. So right before the needle comes out of the skin, you want to stop injecting. But again, really, we're doing this, you know, because it's a teaching program. She's letting you do this and everything, but she doesn't really need injections into the nasolabial fold. Like if she were coming in and this is my patient, I wouldn't say, okay, we're going to inject her nasolabial fold. If anything, I would work on her cheeks, if anything, and that would bring it up. But again, there's no harm in this, and she's getting a little bit in that area, and it'll puff it up. Just for the audience and everything, I want everybody to know that would not be like the first line treatment for her. Oh, that's good. Yeah. A little, not so deep, a little less, a little more superficial. All right, that was good.